Hi again. Now we are going to discuss about general aging and tissue replacement treatments and stem cell injections for plastic and reconstructive surgery, as well as fighting aging. Now, to start with, we have to understand the aging. We are having strong bony structures. We have a strong chin, we have a strong cheekbones, we have strong eyebrows. With the time, the skin is sagging not because it is losing elasticity, but majorly because we are losing the bone support. The problem is a deep tissue and deep bone volume loss. Defense against aging is to replace that volume. Naturally, the treatment is supposed to be in relation to it. So we have to somehow get a patient's own tissue and inject it to the places where we lose this support, where we lose the volume. This can be done in different ways. You can do this when the patient is very young using fillers, but they have really a lot of complications, particularly in the lower eyelid area, they are not as visible. But if the problem is really very small, just lateral side of the chin, etc., fillers can be a solution. But usually after the age of 40, we need to use patient's own live tissue in order to replace that volume. By taking the patient's own fat from anywhere where the patient doesn't want to have that fat, so with tiny cannulas we go in, we get a bit of fat tissue that takes around 10 minutes. We just digest the fat using specific kits and separate, harvest and isolate the stem cells of the patient in, let's say, half an hour, 45 minutes. And this fat tissue, after cleaning, is injected right on the places where we are losing the bone support. So like around 10 minutes to harvest the fat, 10 minutes of injecting the fat, we can just replace the volume, and with one shot we can put the volume back, but also we can simply lift the sagging skin with fat grafting. To summarize, all these procedure can be done under local anesthesia as well as sedation, but absolutely no general anesthesia is needed. The whole procedure takes around 40 minutes and the patient needs to stay at the hospital or at our clinic, let's say around 2 to 3 hours. After 3-4 hours they can go back their home. Of course there will be a bit of swelling, might be a bit of bruising, but usually there is not a huge edema or swelling, and the patients are supposed to come back to control after 2 days. Once we see the patients, they can just wash their faces, take a full shower, and after the 3rd day, 4th day, they can go back to their normal life, back to their jobs. Stem cells can be used for fighting aging on the face, but also for breast reconstruction, to fight radiotherapy injuries, acne scars. If there's any soft tissue trauma, all these can be treated by patients on autologous stem cells. So stem cell treatments, fat-derived stem cell treatments, are the cutting-edge treatment of our century.